Welcome back to Calcium Therapy. Mark Manhart here. Say, I just was talking with somebody and I thought of this, that I should explain this about diagnosis. When a dentist works on a patient or anybody, a physician, you have to keep in mind that the patient has a sense of what's going on and we should listen to the body. Remember I said, look at your gums and you can kind of tell what's going on? Well, that's a way of listening to your own body. And there was a case that came from Arizona where she just said, it got down to this: I knew there was something wrong and she couldn't pinpoint it, but she was trying to explain to the dentist, I know that there's something wrong here. Well, they finally came to a diagnosis that yes, the dentist listened to her, and yes, they found a dead tooth. So if your body is telling you something that, it's just something underneath, listen to it. And if you're dealing with a dentist, make sure that they are listening. In other words, a blind diagnosis is not good. You can't blind yourself. I can't blind myself to what that patient feels. And saying there's no symptoms. Well, one of the symptoms is that patient isn't comfortable and something is going on. And between the two of us, we got to figure out, or between the six of us, we got to figure out what's going on here. So that's why when somebody says that to me, that's when I begin to really listen. When they say, I just know there's something here because of this and because of that. Listen. And what that makes a dentist do is you diagnose of what's going on, and then you re-diagnose when you get more information, and you get more information, and you re-diagnose. And I'm going to talk to you about some of those things that, I mentioned the people that we've learned things from. That's how it works in such things as complicated health care. Is if we're climbing up this tree and it ain't going anywhere, we got to find another tree, and we have to listen to each other. So diagnosis is, I like to put it, diagnosis is dynamic. It's going and it's changing. So remember that when you talk to a dentist or a hygienist or whoever it is, because I think that's what any professional like this, that's what we're listening. How do you put it? That's what we need to make good decisions. Thanks for coming.